My name is Sarah-Jane Heathcote. I'm a veterinary surgeon at Isabelle Vets. I obviously do my normal everyday cases, but my main interest is equine dentistry. I have a certificate in Advanced Equine Dental Practice in Equine Dentistry with the Royal College of Veterinary Surgeons, and today we're with Fantasia, who's a 15-year-old, and we're going to have a look at the teeth and see if we have any issues that we need to deal with. So generally we're in good health, and we've examined around the head first just to make sure there's no obvious problems I can feel on the outside of the head which might indicate a problem inside. And we're not having problems with it being ridden, are we? There's no other issues that way, and eating isn't a problem, as with many horses, but what we find sometimes is that they don't always have a problem with eating, and it might be very subtle changes that are going on that we need to pick up with examination. So we'll put the gag on, and we'll see how we cope with this, and just make sure he doesn't knock you. Okay. So do try and have a look at all the soft tissues in the mouth, the tongue, the roof of the mouth, under the tongue, and all the gums, because we can see then if we've got sharp points related to those teeth. That all looks fine. I don't have any wolf teeth, which you would usually find just in front of these first upper cheek teeth, so we don't have any issues there. And we'll just have a little rinse out with some water. Everything's already been popped out, so we'll just give this a good rinse. If there's any food material. He can get his revenge and spit it all over me. We'll just have a feel now. I tend to have a feel along each cheek tooth row, so basically 4 rows and each with 6 teeth. And just see if I've got any gum disease that I can feel, or any loose teeth. And just feel the regularity of the cheek tooth rows basically. So I've got a few little points on the inside of our lower teeth, and a few little points on the outside of the upper teeth. And there's a previous fracture. He's lost a little bit of about a quarter of a tooth on the outside of his upper left side. Now, because they tend to get fractures on equal sides, I'll just double check the other side. Okey-doke. I'll just have a look with a mirror. To help us visualise the teeth, because we can't really see them because they're all sort of right at the back of the mouth, we use these angled mirrors. And they're quite handy for us to have a look, because at the back of this horse's mouth we have a fracture on one side which is just chipped off some tooth a while ago. That's all fine, but we need to check that one, and we'll also check the tooth on the other side in the same position, because it's likely that this horse might have the same problem on the other side. So we'll see whether he'll let us have a little looky back here. And right to the back, and we can get a mirror image of that back tooth. And that looks good. And we'll compare it to this side. Let's see if you grab your tongue, my friend. Good boy. Steamed up a little bit, so just have to warm it up. It's a cold day here. He has a lovely warm mouth. Just there. You can see it. Thank you. That looks fine. Just chipped off the outside a bit, so there's no guts gathering food. Okay. So this is our motorised power instrument that we use to examine and to file down horses' teeth when they've got sharp points. So this is a battery operated machine. It's quite nice and quiet. I do tend to put it on before we go near the horse just to see what reaction we're going to get. So it's really quite quiet, and it means that we've got a nice long handle so we can access all areas of the mouth and try and reduce any sharp points that have occurred on usually inside the lower ones and outside of the upper ones. And it's something that really has helped speed up dental work, but you can only really use it in horses that are quiet or sedated. Okay. This, eh? Okay. I'm just going to hold your tongue. Ready? And keep it the sides. It's going to disappear and see what he does. So just tease along basically. Good there. Good lad. That is a brave sausage. Yeah, well done. And by using the torch you can visualise what we're doing at the same time. His roots will start to narrow the next 5-10 years. A little bit more on that side. We'll just concentrate on the lowers first and then we'll steam it up. So this is the different, still the battery powered motorised instrument, but it's on a curve this with a flexi disc that turns. So if we turn this on, see what the horse thinks of it. And it spins around as a disc, so it takes up material and it gives us a nice smooth even run along the upper arcade to look at his upper cheek teeth and to try and make sure that we can take off any points that might be digging into his gums on the outside of the upper teeth. So a slightly different shape to our last one. Are you okay, Ken? Yeah. Let's see there. Well done. It's fine, that little fractured bit. It feels like, you know, there's nothing trapping in there, it's not painful, I'm pushing it now, it feels like the bit of tooth that still remains underneath it is throwing down quite normally. Okay, so these are the manual rasps, which is what we always used to use before we had motorised ones. These are lovely and light, they're very thin profile, so there isn't much room between the tooth and the tissues, which is nice and comfortable for the horse. These are made of a solid tungsten carbide and they're chipped in the surface, very very sharp but nice and smooth and easy around the shaft, just to get to different areas of the horse's mouth, so we have different shapes that we use depending on which area we want to rasp. Okay. Okay, just helps those tops. And then I'll just get one other one if I fit it. This is what we call a diamond S float rasp, which is just that nice S shape to it, which is really lovely if you want to do anything around the front of the mouth, just to try and protect the soft tissues around. So we've got the tongue and we've got the cheeks and all those lips, you know, you don't want to catch sometimes with the other rasps, and this one's really nice that we can sit nicely in our fingers and just get to these little edges that we want to round off, especially at the front of the tooth, so that the bit is comfortable in the mouth, and I find it particularly a nice piece of material to use on the teeth, and they tend to tolerate it quite nicely. I just tend to move it around the front of the tooth, like so, if I feel. It's quite nice to use on the lower ones as well, because there's obviously got tongue there, and cheek, and lots of tissues that can get trapped in the other materials that we use to rasp. I'll just grab the mirror and have a double check of that fracture now we've treated that. Just have a look with the mirror, my friend. That was good. Tissues are all fine around it. It's not trapping any material. That's good. Lovely. we go. I'll take this off you now.
That's very good.
Very good. Oh boy, that deserves a polo mint. Really?